Welcome back to 3 Plus U. Well, we have a great guest coming up right now. Let's introduce Bonnie and Preston. Bonnie Watson is the Director of Substance Abuse Programs for Focus Treatment Centers. We also have Preston Goforth. He's the Director of Admissions and Business Development. And Focus Treatment Centers, I love what you guys do, but I'm going to let you talk about it. Focus Treatment Centers, you've been on before, but for those that aren't familiar with what you do, who you are helping, tell me about Focus Treatment Centers.
Sure. Focus Treatment Centers is a substance abuse treatment center that's been here in Hamilton County for the past 15 years. We're locally owned by a family that absolutely loves this community. And really the focus here is to get people back to the lives that they were meant to live before addiction took over. Because we all know that when you're 8, 9 years old, no one's dreaming of being addicted to something when they're in their 20s, 30s, or 40s. No one's wanting to have their lives a complete mess. I mean, that's not what they want for themselves. So here at Focus, basically what we're doing is helping people find who they were meant to be. Helping them learn a new way, a different way of life, and helping guide them through that process, and helping them become who they were supposed to be. Business owners, starting families, whatever that looks like for them. We want them to be successful, and the family that owns this wants that same thing for anybody that's struggling.
So how do you get somebody to understand that need? Because at some point, an addict, someone stuck in that mire, needs to come to the realization that, you know what, I got to get help. What do you tell people, family members maybe, who have someone like that in their life, or maybe someone with that addiction is watching right now? How do you get them to make that step of just making the phone call, walking through the door?
Sure. One of the things whenever families reach out to us and they ask us about family members that are struggling and how to approach them, how to talk to them, we basically just encourage them to approach that family member or that loved one from a place of care and concern. Simply state your concerns, things that you're seeing that you're worried about, some things that you've seen in their behavior, or maybe some instances that have happened that you're concerned about. Be very clear, be very direct, and then also be prepared with information about next steps. Encourage them to do some research on their own about help that's available out there. We're more than willing to have conversations with anyone, about behaviors that they're seeing with their family members or their loved ones that they may be concerned about. We have a great admissions team, people that are here answering the phone 24 hours a day, that can talk to a loved one or can talk to the actual person that is struggling, answer any questions that they have about some behaviors that they're concerned about, and what and if help and what help would be available to them here.
Whenever you mention the word addict, it draws up a lot of stereotypes. But an addict can be someone that you don't even know has a problem with alcohol, with drug abuse. And they may be somebody that you're working with, maybe somebody that's in your family and you don't even realize it. It can come in all shapes, sizes, ages as well. Is there any specific category, be it age, be it socioeconomic, that Focus treats? How do you determine who's able to come through the door?
Well, basically, we treat adults is the easy way to say it. 18 and up. As far as socioeconomic group, no. We're open to treating anybody, because basically, like what you just said, addiction touches everybody. There's really no family that has not been touched by addiction in some way. Especially over this past year, or last year, I should say. 2020 was so rough on so many people. So much isolation. People that had church groups or maybe breakfast groups, just the support of getting together. And once you're alone and isolated, cut off from your supports, a lot of times people do return back to old habits. We saw that a lot, to be honest with you, where people had an issue, maybe even years ago, had become successful, and then were isolated from those support groups that they had during 2020 just due to COVID. And kind of return to that old lifestyle. So we actually had a lot of folks we were able to help kind of through that process. They came in for just a few weeks, and we were able to help.
It really is amazing how in the process of dealing with COVID, all of these other side issues are creeping up that we never even think about this being one of them. Speaking specifically of when someone walks in the door at Focus, what are some of the services offered? How does it work? Take me through day one.
Okay. We offer a couple different levels of care here at Focus. Basically, we determine what level of care is appropriate for you based on an assessment you would do with one of our trained admission personnel. And then we have a residential program where patients actually come and stay at our facility. We have medical detox. There's full 24-hour nursing staff. We have doctors that are here that meet with the patients, and then we have a full clinical staff too. So we're working from all angles of the addiction, working with the medical detox part of it, but also getting the patient in touch with a clinical staff that can help them develop coping skills to get back to that lifestyle and their goals that Preston spoke about earlier. We also have an outpatient program, and due to the nature of the world that we live in right now, our outpatient program actually is virtual. So there are a lot of options that are available to people that haven't been in the past due to COVID. So there are residential and outpatient services that we do offer here.
And I'm assuming it varies, but what's the average length of time that someone typically will go through the programs at Focus?
Sure. We have typically a person will stay on the residential program anywhere between 2 to 4 weeks. It's very individualized based on their medical and clinical need. And then our outpatient program is typically around 6 weeks.
And is there support after they leave? Because 2 to 4 weeks, that's great treatment, but then they're out on their own. Do you guys support afterwards?
Absolutely. We actually have an alumni coordinator that's basically what they do. They follow up with folks a matter of weeks after they leave, and then follow them for the next year, to be honest with you, offering support. We have get-togethers that the alumni coordinator comes up with. We're actually thinking about partnering with some other treatment centers here in town to have an event that's coming up September.
Yeah.
Absolutely. Yeah. I mean, kind of like what we were saying earlier, we want them to be as successful as possible. Whatever we need to do.
And guys, we're about to have a hard cut off Bonnie Preston. Thank you guys so much. And let me encourage folks, if you have somebody dealing with addiction in your life, get them to Focus Treatment Center, Shaliford Road, 308-2560.